Good morning. Today we have a very, very special guest. It's Dr. James Pinckney, and he is with Diamond Concierge Medicine. And I want you to just start right off and just tell us, what is concierge medicine?
Well, thank you, Joe, for having me on the show. Really excited to be here. I haven't seen you in a while.
I know.
We've both come a long way. Mm-hmm. So I am the CEO and founder of Diamond Physicians here in Dallas, Texas, and we've got 4 locations now. And we started back in 2012, opened our first location officially in 2013, and our whole premise was to offer concierge medicine at an affordable price. So right now in healthcare, it takes a long time to see a doc. Sometimes the national average right now is about 46 days. And the average visit is 8 minutes. And I can't do anything in 8 minutes. I can't get to know you. I can't establish rapport. All I can do is write a prescription and go on to the next. And that's not the style of medicine that I wanted to practice. So we created this membership medicine model in order to really reinvigorate the patient-physician relationship. So we charge a monthly membership fee at our Diamond locations, and our clients receive unlimited visits, never a copay, 24-hour access to their doctor. So they can call me, they can text us, they can send us messages and video chat through our HIPAA-compliant app called Dr. Link. And then we throw in unlimited urgent care. So if a client has a stomach bug and they need Zofran, which is a nausea medication, and some IV fluids, they come to our office. We take care of them, no additional charge. If someone falls in the middle of the night and bumps their head on the nightstand and cuts themselves, they can come in and we'll sew them up, do a laceration repair, no additional cost. So it's pretty amazing the value and what we offer in our services. And then we throw in 90% discounts on labs and imaging. So think of it as health insurance for what's underneath your deductible. So people that typically have a catastrophic plan or Medicare, they have a deductible, right? Mm-hmm. $3,000, $5,000 or whatnot. And the insurance kicks in after your deductible, but most people have that out-of-pocket expense up to the deductible, and Diamond helps mitigate that risk.
Wow. I have a friend whose son broke his leg, and I think he went in for a cast. I think their out-of-pocket was crazy expensive. And the bill to insurance was several $1,000s. And so it's just not something, something minor cost us so much when we use our insurance,
It really does. And we actually offer services that are equivalent to some of these freestanding ERs. I've got 8 years of ER experience. So all the Diamond facilities, we do splinting, and we don't have x-ray on site, but we can do an x-ray off site for $60. So in that scenario where someone breaks their arm or breaks their leg, we come in, examine them, send them to an x-ray for $60. If it's a fracture that doesn't need to be reduced or anything like that, then we can come in and splint that or even cast in our office.
That's great.
That's all included except for that x-ray.
Well, our podcast is about seniors and being advocates for seniors and talking about what's out there. And tell me about you see all ages. You've got a pediatrician now on staff, which is wonderful. So you take care of children all the way to, the aging elderly. Tell me about your patients that are specifically seniors, and how is there a difference in what you do? How can you make their quality of life better?
Yeah, that's a great question, Joe. So we have, I think, 20 to 25% of our members are over the age of 65. So this is the Medicare territory. Mm-hmm. And yes, they have insurance. A lot of them have secondary insurances that are private, and they have good coverage on the back end. But the Medicare system is really overloaded. Mm-hmm. And a lot of doctors are actually opting out of the Medicare system because reimbursement rates are a little bit lower. And they want to get that nice PPO, private insurance reimbursement, which I can totally understand. But it's really affecting our baby boomer population. And that population is growing. So with Diamond, they actually get access immediately, and they don't have to wait. And I mentioned that the national average to see a doctor is 46 days, and sometimes 3 or 4 months to see a specialist. So we can bypass all the wait times, see our clients same day, always same day, and even get them into our specialist networks in 3 to 5 days instead of 3 to 4 months.
Well, let me ask you. Okay, so say you've got a patient that is one of your patients and they need Medicare services like home health or hospice. Can they still have those services? Are they still available to use those Medicare?
Oh, absolutely. So think of it like this. Everything within our 4 walls is covered with that Diamond membership. Everything outside of our office is on the insurance wheel, or you can pay cash. So we have cash pay discounts on a lot of those things. So we still work with home health agencies and hospice. And I, unfortunately had to put a patient on hospice a couple weeks ago. But that all remains intact and remains the same. But it's just that continuity of care and that great physician relationship that you get with Diamond for our seniors that is really special. And sometimes we'll even do house calls, and we can really do some things that the traditional insurance model just can't do with primary care because you don't have time. The national average, again, is 8 minutes. If I've got a senior with 5 comorbidities, they might need an hour to an hour and a half with me. And all of our doctors spend at least 60 minutes with our clients. So that's really the great thing about it. They don't have to be cut off and say, oh, you've already talked about 2 issues today. You have to come back in 6 weeks and talk about the other 2 issues.
I know. Isn't that sad?
It's really sad. We can sit down for an hour, hour and a half, knock out all the things that they want to talk about, all the questions that they have, and really take that time, medication compliance, and just explaining why we're putting you on a certain medication or putting you on a certain diet. It really helps with compliance if you understand the why.
Mm-hmm. Sounds good. Okay, you went to Austin and you spoke with senators, and I know you are passionate about certain things in healthcare. And tell me about your trip and working with senators. Tell me about what happened.
Yeah, so we had a great opportunity. I was in Austin a few weeks ago talking about Medicaid reform. And then we got to go to D.C. to talk to our congressmen and our senators about HSA accounts. So one of the things right now that is inhibiting the membership medicine direct primary care movement is the fact that consumers cannot use their health savings account or flex spending account on direct primary care on our membership fees.
Oh, wow.
It's an IRS coding issue. It doesn't make any sense because we are providing primary care. Mm-hmm. It's not a covered medical expense under 213D right now. So I went to D.C. to lobby to our congressmen and our senators to have a bill that would allow consumers all across America to use pre-tax money and pay for direct primary care, pay for Diamond physicians and practices like ours all over the country.
Wow, that's amazing. Yeah, with private duty, it is considered spending, dependent care. So for us, they can use our care as a write-off. But
Right.
That's interesting. I wouldn't know that. Okay, in 4 sentences, tell me what is wrong with Medicare.
Oh, and only 4 sentences, Joe. That's a tough.
4 minutes.
Okay, 4 minutes. Medicare is a great premise. The idea of all Americans paying into a pot to take care of the elderly is a beautiful concept. But unfortunately, the way the insurance system is set up, it is prohibitive to providing high quality care to seniors and really everybody. Mm-hmm. So there's been some talk about going to a single payer system and Medicare for all or Medicaid for all. And the problem with that is it will actually exacerbate a lot of the issues with time. Yes, it might not cost anything, but if it takes you 3 months to have surgery on a broken leg, then the comorbidities associated with that fracture are going to be even worse. Mm-hmm. And that's why I think that the private sector is the perfect place to kind of reform healthcare, and that's what we've done. Mm-hmm. Diamond Physicians allows that patient-physician relationship to be at the forefront and not in hindsight. So insurance should be used for catastrophic things only. It should be used like your car insurance or your home insurance. When you fill up your car with gasoline, you pay cash. If you need new windshield wipers, new tires, you pay cash. If you get in an accident that costs thousands of dollars, that's when you file an insurance claim and you pay your deductible. Mm-hmm. If we use that same concept with health insurance and Medicare, the spending would be much lower, and we would actually have a great system that actually worked. When you use Medicare for flu shots, for knee braces, for simple things that you should pay cash for, the price actually increases tenfold. And that's why we're spending almost 20% of our GDP, $3.3 trillion on healthcare, but we don't have the best outcomes. And this is really, again, exacerbated in our elderly population because these are the people that need the highest quality of care. Because as we age, we naturally have more issues.
Right.
So if we could just shift the way we think about insurance and Medicare and use it for what it was designed for and let the private sector, like Acappella Home Care and Diamond Physicians, take great care of our seniors, then we'd have a wonderful system.
Well, we have a mutual client that we referred to you, and he was given about a month to live, and you have been working with him. It's been a year and a half now. You've been helping to take care of him and just doing an amazing job. I've seen personal experience. I also we worked with you on a patient that was on hospice. And what I loved so much about you, Dr. James, was you were so involved with that patient right up until his last breath. And you don't see that anymore. I was a hospice nurse for years, and I see patients on hospice now, and they are not getting adequate care. They're getting the care that Medicare, the minimum requirements that Medicare requires. And what do you do? These people that don't know the system, they don't know any different. They don't know there's a difference between excellent care and,
that's right.
Tell me about a couple questions. What are your thoughts on the flu shot?
Oh, I'm a big proponent of vaccinations. The influenza vaccine, yes, we get a lot of flack here and there because it's not as effective in certain years. But, it's a guessing game, right? Mm-hmm. They try and make a combination of the vaccine that will be as effective as possible. But at the end of the day, the flu vaccine lowers your risk of death by 5 times. So even if you get the flu, your chances of dying from the flu are much less. And that is what I constantly preach to people that are anti-vaxxers or don't want to get their flu shot, especially in the elderly population. Mm-hmm. Kids and the elderly are the most, and immunocompromised are the most susceptible to the flu. So, and any ailment. So it's really important that our seniors get their flu shot. It saves lives. 90% of the people that died from the flu in 2018 were not vaccinated.
Wow, that's interesting. Also a question about nutrition. Okay, I know that your clients can come in because they've got the flu or bronchitis or a stomach bug. But what about, do you do preventive care, wellness? Tell me about that part of just the important qualities in staying active and staying ahead of things. Yeah. How does Diamond work with quality of life?
Yeah. So our entire model is a holistic model that's built on being proactive rather than reactive. So preventive care is a critical component of what Diamond Physicians, what we do. So we work on nutrition counseling and exercise counseling, and we want to see our clients once a quarter, even if they don't have an ailment. There's so many things that we can do to work on optimizing their life and optimizing their performance and keeping that high quality of life. And that is the way I want everyone listening to think about their health. Health is the new wealth. So you only have one body. And think about this. If you didn't take your car in to get oil changes and have maintenance, it would break down and you'd have to replace certain parts that would cost you a lot of money. So why don't we take the same care of our bodies as we do with our other tangible things like cars and boats and our houses? You have to bring your body in for maintenance, I think, once a quarter. Get checked up, make sure everything's going well. Right now in the insurance model, it's sick care. You only call your doctor when you're sick. We should be health care. Mm-hmm. Call your doctor, not just when you're sick, but when you have a question about nutrition, when you have a question about, okay, how much should I be exercising? What should my heart rate be? Things like that. And that's one of the beauties of Diamond Physicians is that you can call me whenever you want. You have any questions about anything, we're available. Text, email, video chat. Mm-hmm. It's all on the table.
I know. Okay, so as far as a senior, and I know we're not talking about a diabetic patient or cardiac, but in general, what should their diet be?
It's typically it's the same as all. I think all ages need to be on this diet, right? Limit your sugar, okay? Mm-hmm. Refined sugars, all right? Limit your carbohydrate intake. So gluten is highly inflammatory. So I like my clients just to cut out gluten altogether. I know it's hard. I love biscuits. I love bread, but it's really inflammatory. High fat, good fats, unsaturated fats, avocado, olive oil. These are nuts. These are great things, except for peanuts. Peanuts are inflammatory. Those are great things that you need to not only boost your thinking in your mind, these superfoods, but also it actually helps you lose weight. So it's like eat fat to get thin. It's a misnomer, but it really does work. Plenty of water, and then lean proteins. So chicken, fish, try and avoid red meat. A good grass-fed steak is fine every once in a while, but red meat does increase your risk for colon cancer. So stick to lean meats, and then of course lots of fruits and vegetables. Mm-hmm. And in fact, vegetables should be the largest serving. on your plate?
Well, my last podcast was on diabetes in the nursing home and in the Medicaid population. And 25% of nursing home residents on Medicaid are diabetic. And I learned that I've done a little investigating, and the trays that these patients get in our residents in the nursing home are exactly the same for diabetic patient as non-diabetic. The only difference is the non-diabetic get a full piece of cake, the diabetic get half a piece of cake.
They get a piece of cake?
That's yes.
Oh my goodness.
So if you've got somebody, a senior struggling with type 2, everybody now I think is on the move to lose weight and be healthier. And I love that. We've been all this processed food, fortunately we're getting the education that stuff is not good for us. And there is a lot out there, on eating healthier.
Yeah.
And so as far as, do you have a lot of patients that are type 2 diabetic that just weight reasons or?
Yeah, when they come to us, they are, but after a year, they're not. So we can completely reverse insulin resistance, typically with diet and exercise. It's not easy. You have to have behavioral change. But if you can cut out the refined sugars, eat a high-fat diet, and then we didn't talk about dairy, but dairy is highly inflammatory. Mm-hmm. So fermented dairy is okay. So yogurts and things like that. But for the most part, you should try and cut out dairy. Add some fruits and vegetables, lean meats. Then you can reverse insulin resistance altogether. Now, if someone has really bad diabetes and they have a lot of insulin and their pancreas is pretty much tuckered out, then that's a different story. But most type 2 diabetics that come to us, we can completely reverse it and get them off of medications and get them on the right track.
That's wonderful. Y'all are doing an amazing job. I'm trying to think, is there anything else that you'd like to share about your senior program?
I think the key to this is don't use your insurance to improve your health. That's not a good way to look at your insurance. People say, I've got great insurance. When it comes to your health, you need a great doctor. And unfortunately, a lot of the great doctors are leaving the Medicare system. So I want the listeners to keep that in mind. And if this is for you or for your parents, really consider Diamond Physicians and other direct primary care practices around the country, because it's an elevated level of service and care. And your health is your wealth, and our seniors deserve the very best care. Our seniors and our veterans deserve the very best care. And unfortunately, they're not getting the very best care. And that's something that I'm passionate about, and I've dedicated my life and my career to improving the health of others and really making an impact and lowering the cost and providing an infinitely better service.
So is that your vision? Is that your vision for Diamond?
Yeah, we started with one shop here in Dallas, and now we've got 4 locations. We've got 8 doctors, and we add the pediatrics brand, and we would love to have locations all over the country. Our vision is to provide affordable health care to every U.S. citizen. And healthcare delivery in America has to change. We spend too much money, don't have the best outcomes. And that's my passion. That's my vision. I feel like that's why God put me here on this earth, is to really reform healthcare and make it easier for everyone to have access to great care.
Mm-hmm. It's been such an honor to have you here today. And if people want to call Diamond to get some information, what's a phone number that they can call?
You can call 214-395-3491. You can go to our website, diamondphysicians.com. It's a wonderful service. Check it out. It's amazing. I love your service too. We use Acappella all the time for private duty, and you guys take great care of our clients. So Acappella is fantastic. Diamond is fantastic.
We are, and you know what? My thing is, if you provide the right care, the business is going to keep growing.
Absolutely.
And with us too, it's about being proactive. How can we coordinate care? Be proactive, do the very best for our clients. And you are just an example of what a wonderful job you do. And thank you so much, Dr.
Thanks for having me on the show.
I appreciate
it.
your time.
Awesome.